Reporter Stephanie Stahl is here now with more on the virus that continues to spread quickly, especially there in China.
Yeah, but here in the United States, health officials say that there's no evidence that it's really spreading here. Is that right?
That's right. That is a very important distinction. You know, these possible cases that keep popping up are about coronavirus has the same symptoms as the flu, but the confirmed patients so far have all traveled to China. The CDC says about 110 people are currently under investigation for potential cases. They are in 26 different states. They say the risk for infection is low, but they are expecting more cases to pop up.
Federal health officials say the number of coronavirus cases here in the U.S. remains at 5. Those cases have been reported in travelers from China in 4 states. Health officials are also keeping an eye on 110 people in more than 24 states for potential cases.
We're looking very hard. There have been many travelers that have come back from China, and so there's every anticipation that more cases will be diagnosed but will be taken care of appropriately.
The outbreak of this new coronavirus started in Wuhan, China. More than 2,800 people have been infected so far. More than 80 have died. The outbreak has prompted screenings at 5 major airports in the United States. About 2,400 people traveling from Wuhan have been evaluated, and the agency is considering broadening screening. Symptoms may include runny nose, headache, cough, sore throat, and fever.
The incubation period is the time from exposure to the time that you become sick. And that period ranges from about 2 days to up to 14, perhaps an average of 10. We're learning more about that as time goes on.
Zachary Clacy, a virologist at Philadelphia's University of the Sciences, says coronavirus symptoms are very similar to the flu, and influenza is a much bigger threat to Americans right now.
I would be more worried about the flu, right? The flu is already here. People get the flu every year. It causes tens of thousands of deaths.
The CDC has developed a test to diagnose this coronavirus and is now working on a plan so priority states get these testing kits as soon as possible.
Now, federal health officials also say it appears the virus survives just hours on surfaces, so there is low to no risk that coronavirus can spread from products or packages shipped from overseas. So lots of fronts on this. But at this point, I think the risk here right now is very low. The flu, as he said, a much bigger danger.
Sure. Something to be concerned about. Thank you.
Thanks, Eb.